I think we're pretty far down the road, but there's a lot of opportunity remaining. In fact, we've established a governance committee of operations and information systems and clinicians together to take a look at the various AI tools that are in development or have been utilized in other healthcare systems to make the decision is should we deploy this within our health system? If not today, is it sometime in the future? All in the spirit of the effort to redesign how we deliver healthcare.
The business of healthcare is hard, creating a badlands of terrain that is difficult to navigate. Some think the most brilliant minds in business are on Wall Street. They are wrong. The most brilliant minds are in healthcare. They have to be to thrive and survive. This podcast explores concepts in leadership, management, sales, and negotiation with those brilliant minds. The Healthcare Badlands podcast is generally planned, but unscripted, unedited, and uncut, so you get the honest and unfiltered experience. Your host is Dr. Tom McDougall, a 30-year veteran of healthcare with 23 years of hospital CEO experience. His guests are carefully selected experts from across the industry. They offer insights, expertise, and some great real-life, often hilarious stories. Now, let's jump into the episode.
Welcome to the Healthcare Badlands podcast. I've got today a really exciting guest. It's Shane Spees. He is the CEO of North Mississippi Health System, a very impressive system. It's got a long background in healthcare, also has a law degree, and I've known Shane for a number of years, and I just know what a fantastic leader he is. So I'm super excited about him joining us today. So Shane, welcome.
Yeah, Tom, thank you for having me today, and it's great to see you again. It's been a while. I'm thankful that we've stayed connected over the years, and it's really a pleasure to be with you today.
Well, thank you so much for investing time. So my first question for you, and I've never asked this question of you, but you started with a law degree, and I know you've got a healthcare degree also, but you started with a law degree. So when you were in law school, did you see yourself as a health system CEO in the future?
I'm asked that pretty often, Tom, so I'm prepared to respond to that. But
Excellent.
I wish I could say that I had a grand plan, coming out of high school and into college of working towards becoming a healthcare CEO, but that's far from the truth. But I'll say when I was a senior in college and I had an aspiration to go to law school and be a lawyer, and so I certainly that senior year of law school. Of college, applied to law school, but for some reason I had healthcare administration as a plan B to law school. But I never applied to graduate programs in healthcare because I was accepted in law school and that was my path that I chose, and so got into law school. But after my first year of law school and clerking the summer after my first year of law school, I quickly realized that that's not what I wanted to do the rest of my life. And so I started my second year of law school recognizing that I needed a plan B. And for some reason, that plan B that I had before of healthcare administration popped in my head again. But what's interesting is I knew nothing about healthcare administration. I'd only been in a hospital once in my lifetime, but for some reason, healthcare administration was something I thought I wanted to do. And so I started making some phone calls to inquire about what it is and how to get into it. And I was connected with the CEO of Memorial Hermann Healthcare System, Dan Wilford, who coincidentally went to Ole Miss, which is where I went to undergraduate. He was a previous administrator within North Mississippi Health Services in Tupelo, Mississippi, between the late 70s and early 80s. And so a mutual friend connected us. Thankfully, Dan took my cold call, and I was very honest and said, Dan, I know nothing about healthcare administration, but I think I'm interested in that career path. Can you help me learn more about it? Long story short, he invited me out to Houston, Texas, to talk with a number of leaders in healthcare. Also to take a look at the University of Houston's graduate program in healthcare administration and meet the program director. And I left that visit to Houston That was my second year of law school. I left that visit from Houston and said, that's what I want to do. So I literally took a leap of faith. And fortunately, Dan offered me an opportunity to work in healthcare while going to graduate school. So it was an opportunity I could not turn down. And so that was my
Yeah, that's
first foray
fantastic.
into healthcare. So I worked for their health system. And at the time, Memorial Hermann had a joint venture with another regional based health system that was focused on health plan activities and outpatient ambulatory services. I got a chance to do a little legal work as well as get exposed to the administrative side of healthcare while going to graduate school, which I think was a real plus for graduate school because I was able to apply things that I was learning during graduate school. Did my administrative residency at Memorial Hermann Healthcare, and kind of the rest is history so far. So very fortunate to have had mentors like Dan Wilford who were willing to invest the time and energy and in helping me learn healthcare, giving me the opportunity to try things, to fail, and try again. And so it's and I think the real when I was exposed to different subjects during law school, I tended to migrate to those business related subjects in law school. And actually in law school, the further along I got, I realized that I wanted to be in some profession where I could mix business and people and work with both business and people. And healthcare gave me the great opportunity to do that. And so after making that leap of faith, moving to Houston, Texas, getting some early job experience as well as my graduate program in Houston, uh, it confirmed that that's what I wanted to do.
Interesting. So did you have any thoughts about quitting law school, or why did
No,
you, it's not easy. So why did you keep
yeah,
pushing through to finish?
Tom, I actually, I never had any thoughts about quitting, but I did second guess, does it make sense to continue law school and then pursue a master's? And I talked to several lawyers who had transitioned from legal practice into some type of business, and they confirmed that Shane, stay the course, complete law school, get your license, because that's something that you'll have with you and take with you for life. Plus, it'll give you the experience and as I've learned over the years, Tom, that law school background it has been invaluable in helping me as a leader understand a lot of the components of healthcare because we're so regulated. So much of what we do is built around contractual relationships. So that all really helped me. I think was a key ingredient to my success as a healthcare leader. And I remember this. Dan Wilford told me when I started out, he said, Shane, your legal background will put you on a fast track towards healthcare leadership. And he was dead on, dead right in
Yeah,
that.
that's excellent advice. Okay, so I got to tell you just a brief story because years ago I was working on my doctorate in healthcare administration. My father-in-law, who I love to death, I've known the man now for well over 30 years. He's like a father to me. He called me one day and he said, Tom, I'm going to take you to lunch. I said, yes, sir. I wasn't going to argue with that. And he sat me down and I was in my, I was mid to late 40s. And he said, Tom, I've made up my mind about something. I said, okay. He said, you need to go to law school. And I said, Dale, I'm already in school. I'm already working on a doctorate degree that I can't figure out why I've gone back to school. Why do you think I need to go to law school? And he said, because you can negotiate with anybody on anything and you need to be an attorney. And I was like, yeah, I'm not going to law school. But I say that to say, and I've never had an opportunity to thank you for this, but years ago, you and I were in the same market, and I filed a certificate of need application for the hospital that I was leading. And you were so kind to file a competing CON application. And I've never thanked you for that. So thank you so much, Shane. I really appreciate that.
That's what,
That
yeah,
was
that's
just
what
awesome.
competitors do, right, Tom?
I know. But I remember something about you because you were a formidable opponent through that process, and it got contentious at moments, but you always had this big grin on your face when I felt like you were sticking it to me. And I always liked that about you, is that, even in the worst moments of that little battle we were going through, I'm like, I like Shane. He's a good guy.
Yeah. Yeah. Well, I love to compete, Tom, and it's always easy to grin when you're on the right side of it, right?
That's right. That's right. Well, I'll
When you're on the
remind
right
you
side
though,
of the
I
argument.
was successful with the CON. I know you
You
were
are,
too, but we were the only
yeah.
ones that opened.
Great times.
Yeah, that battle we went through and sitting in front of the CON review board, because I remember it well. The administrative law judge had ruled in your favor, which I was not happy about since I had filed the first CON. And then we get in front of the CON review board and they approve both of us. And it's just like, whoa, where'd that come from? But you remember Roger Bates, the attorney that was representing us?
Yes.
Yeah.
Oh, yes.
We walk out in the hall right after that meeting, and you don't know this story. We walk out in the hall, and Roger is giddy because he has been with me through this battle the entire time, from before we ever filed the application to at that moment. And he is giddy. And he looked at me and he said, Tom, this is amazing. And I said, yeah. I said, it's surprisingly good news. He said, why are you not excited? And I said, Roger, there is no definition of this entity that we just got approved for in the state health plan. We just got approved for something we can't license. And he just had this, it just wash over his face. His grin went away. He goes, yeah, that's a problem. And I said, uh-huh. So
Yeah.
what do we do now? And so it was,
Sounded like an opportunity for the lawyer to do more work, right?
yeah, he wasn't arguing with that part. I had lunch with him a couple months ago. He's a mess. He's a great guy. Okay, so so at North Mississippi Health System, so you've been there how many years now?
2014.
Okay,
So just over 10 years. Yeah.
that's excellent. And I know you got ties to the area, and they're so fortunate to have you there. Um, but one of the things over the years is I've become a student in leadership. So you have gone through a number of economic challenging times, COVID crisis. Talk about how you've approached leadership over a 10-year period, and what is your approach to adapting your leadership style to the environment?
Yeah. I think I consider myself a change junkie, Tom, to a certain degree. So I've always been malleable to change and understanding that change is needed. And then as you think about leadership styles, and of course I went into this somewhat naive in terms of healthcare leadership, but have had the opportunity to face a number of different situations and challenges over the time to realize that you have to adjust and change your leadership style and approach, depending upon those situations. And as I think about just my 10-year history here at North Mississippi Health Services, we've been through a number of different changes that I've had to adjust my leadership style, and therefore my leadership team has had to adjust their leadership
Give me an
approach.
example of that.
So,
What
yeah,
comes to
absolutely.
mind?
So I was thinking about this, and just over the 10-year period, Tom, we've faced what I would consider four different eras within our healthcare system, eras as in time periods. And so the first, when I walked in the door, we were in a significant need for a financial turnaround situation. So the system lost, I think it was $34 million the
Wow.
preceding fiscal year when I arrived. So clearly,
And you
that
took the
takes a
job
dip.
anyway.
I did. That's a story in and of itself, though, Tom. And I knew that coming into it because throughout the interview process, they were very transparent with me, and I asked a lot of questions. But that was one of the reasons I took the job, as I realized the needs of the organization matched well with the skill sets and my leadership approach. And so coming in the door, facing that significant financial turnaround, recognizing that it takes a different leadership approach, right? And so you come in and you have to make some really hard decisions, but you have to really communicate. You have to engage a lot of folks in that process. And but also in a financial turnaround situation, it shows the true colors of your leadership and your leadership team. What do they value? How are they going to manage me as an individual? And so that financial turnaround situation takes a very different leadership style than the second era that I came into after we turned things around financially was a significant growth mode. So moving from a financial turnaround into being aggressive about growing your healthcare system, and that takes a different mindset and approach because you have to really focus on planning. You got to focus on not only planning but alignment across your system around the growth strategy, which entails a lot of communication, a lot of management of resources, and then COVID hits,
Yeah.
right? Which was something new for everybody. And so COVID hit, lasted several years. It was a real test of our strategy that we've developed over a number of years around systemness. So we've fortunate to have a lot of assets, a lot of locations, a lot of hospitals and physician clinics and outpatient operations across the system. But we had worked towards aligning the components of our system and recognizing that we should be able to manage a patient across multiple points or locations within our system. So that approach proved to be needed during COVID, as you can imagine. So it really tested our systemness and our ability to manage patients across the system, not just at one location, which takes
Did you,
a different
let me, let
leadership style.
me ask you a question about COVID time period, because I was also operating a hospital during that time period. And I think I know the answer, but I want to hear your answer to it. Is that we all experience periods of doubt during that leadership time, in that era, as you're mentioning. How did you handle the moments when you had doubt? Because nobody was telling us what to do. Nobody was giving us advice we could hold on to. And we certainly hadn't learned any of those things in a textbook. So I'm sure you felt doubt like all of us did during that time period because we're having to make decisions and we don't know what's going on. How did you manage those periods of doubt?
I'll tell you that um, there was a lot of doubt. And in fact, multiple times a day, there was a lot of doubt, right? Because of the uncertainty that was there. But fortunately, I have a fantastic team of leaders working with me. And it's been a consistent team for a number of years. And so we are, we're very open, transparent as a team. And so, um, we all had doubts. And so that really opened the door for us to share some of our vulnerabilities, like doubt. But really, uh, as a group in our weekly meetings, we would talk about a number of things that were going through our head, questions, maybe doubts, and that sort of thing, and approach it as a leadership team, not as a single individual, because none of us as individuals had all the answers and certainly didn't have all the right answers. But collectively as a team, we could do that. We could come up with some solutions and be willing to try those solutions, but also be willing to change if they didn't work. And just being mindful that everyone has not been through this before. Everyone has a high level of uncertainty and doubt. But you start leaning back on your basic leadership strengths and abilities, not as just an individual, but as a leadership team, and you work through it. Um, and there are a lot of, uh, you know, it's not easy to hear the reports of the number of deaths that occurred the day before.
Yeah.
And then you look at it in totality over a period of time, whether that's a month or a year, you question as to, did I contribute to some of that? Did I not do something that I could have prevented it? But you got to realize that we were doing the best that we possibly could with the information and resources given to us at the time, and being willing to change as we go through it. And we had people very close to us, members of our team, who we lost to COVID, and one of our chief information officer, unfortunately,
Yeah.
we lost early in the process to COVID. You talk about something that was difficult to deal with, not only as an organization, but me as an individual who you reported directly to. That was a tough loss, but tried to take that experience and learn something from it and remember the good and take that forward with us through the process. So doubt existed every day, but we had to lean on our basic leadership capabilities and strengths, to work through that.
Yeah, excellent points. And COVID really had two phases. One was a patient-facing phase where, hospitals, health systems, physicians, we're all aligning to do everything we can to take care of and save the patients. But we also had that second phase of the almost a staff focused, because we all were dealing with the staffing crisis. And so talk about your leadership moving from the patient facing phase to the staff facing phase and how you adapted.
Yeah, I tell you that's one area that we focused as a leadership team over the years is self-care. Recognizing that you need to take care of yourself in order to take care of others, and transferring that onto our staff and supporting our team members in taking care of themselves so they can take care of others with that. So whether it was the protection equipment that you use, whether it's practices that you use to protect yourselves so that you can be available to care for others. A lot of that was around the communication. It was around a lot of recognition that they were going through change. They needed the support to go through those changes, both physically and mentally, with that, and that we were always going to be here to support them. And it was recognizing the uncertainty that existed, but the willingness for us to try and do the best thing possible with the resources and within the values of the organization to do that. And that in every single case, we were going to default to our values as an organization of compassion, accountability, respect, excellence, and smiles with that. And
I
so
like the
those
smiles.
those
That's
kind of
perfect.
carried the day, you know.
Yeah.
And fortunately, we had a lot of support from our community. So the burden didn't just fall on leadership. We had a number of folks that rallied to help support our teams during COVID.
Yeah, that's excellent. How is
And so,
your, I'm sorry, go ahead.
no, I was going to transition to the current era, if you will, but I'll see if you have any other questions related to COVID.
Well, I had a question related to your engagement with staff on that backside of COVID. Did you spend more time out in your hospital talking with staff, visiting with them, connecting? Did you do that, or was that more your team that was kind of tasked with that responsibility?
I'll tell you, Tom, I'll be very transparent in it with my approach in COVID is COVID was a situation where we had to mobilize all of our leaders to a variety of different connection points with their team members. And of course, that evolved over time with COVID. I mean, initially it was a very hands off, distance type thing just for protection, but that evolved into more personal touch, more visits, more rounding, that kind of thing. And it wasn't just me, but it was everyone around us in doing that. And so whether that was, and a heavy emphasis was placed on communication, as you can imagine.
Sure.
And we had various tools and touch points with communication every single day with our team members, whether that was just a daily report that we emailed to folks to give them a current state of affairs with COVID, whether that was virtual meetings among teams that were addressing a particular need within the organization. So communication was absolutely the key ingredient for us in supporting our team members through the uncertain times.
Yeah, that's a great point. And just knowing your style, I'm sure you excelled with that, because you're a connection person.
But
I
I'll tell you,
always, yeah, I've always said I'm a relationship first person. I believe you
yeah.
build relationships, transactions follow, and I know that about you as well.
Well, I'll tell you, Tom, the vulnerability for me as an individual leader going through COVID was the time that I literally had to hand over to our clinical leaders, full leadership and the opportunity to make decisions, make them quickly, also give them the room to change and let them run with those things, because that's what the time needed. I mean, that's what
Sure.
COVID deserved, right? And so it's a little uncomfortable, just sort of handing that over to other leaders, but they did a fantastic job with it. And it was just amazing how well it worked out. And we learned a lot of really good lessons from that, which takes me to the next era that we faced, and which is one that we have really capitalized on since COVID. So coming out of COVID, there were several areas that we recognized that we needed to address as a healthcare system and as a leadership team. And so we focused our energies around redesigning the healthcare system. So we
Mhm.
developed a strategy we call a great redesign. And we launched that several years ago, 2.5 years ago. And we we uh, we learned a lot from COVID. We learned how important systemness is, the ability to use all components of our system to manage patients more effectively, use all the capacity within our system to manage patients more effectively. But coming out of COVID, we all struggled with staffing. I mean, there was a shortage of
Right.
staffing. A lot of staff had left healthcare, and the regulatory burdens continue to stack up on us. We were rolling out more and more technology to aid us in the delivery of healthcare. And so a great redesign strategy came about as to how do we leverage these learnings and these tools that we have to change how we deliver healthcare because it was needed. And so I go back to the staffing situation and recognizing that there's a staffing shortage across the country. And I reminded the group, Tom, that most of us have been in healthcare for a number of years. And can you remember a time during your leadership in healthcare where you said, "Boy, we've got more staff than we need. We've got, you know, nursing is more than we can use and all that sort of thing." But recognizing the staffing shortage, we started utilizing technology to support how our clinical teams do their work and
What are some
empowering.
examples of that technology?
Yeah. So the documentation, clinical documentation, using our electronic health record, and we rolled out an approach we call SAS, which uh, it's a simplify, automate, scale, support, and sustain, and it was an approach to empower our clinical teams, or actually team members across the system, to address uh, changes in how they deliver the care. So I go back to the clinical documentation. We knew that there were components of the health record and documentation needs that were frustrating to the staff. They recognized that it was not all of it was value, and so the challenge to the group was, let's remove the non-value add work that's going on. So clinical team, our nurse team of nurses, began looking at the clinical documentation, how we were using the system, and from that completely redesigned how nurses documented into the system. And so by virtue of that, they saved about 34 minutes on average of documentation time per patient per
Wow.
shift. And so you add
That's
that
a
up.
lot. That's a
So
lot.
you yeah. So if you add that up across maybe the 5 or 6 patients that they care for during a
Right.
shift, it removes not only a lot of burden, but it gives them a lot of time back to spend at the bedside with the patient.
Yeah,
And
that's
so,
substantial because, I mean, 30 plus minutes per patient, six patients, you're saving a quarter of the time in a 12-hour shift. That's amazing.
absolutely, absolutely. And then another example is we implemented virtual nursing. So and this was a learning from COVID. Of course, during COVID, because of the space you needed and the minimizing the physical contact with patients, we utilized technology so that we could communicate with patients and families, and so that patients and families could communicate with one another. And so we leveraged that technology to implement virtual nursing. So today we have a virtual nursing team that takes care of the admission and discharge processes for patients within our hospital here in Tupelo. So it removes the time needed for that bedside nurse to go through that process, allows them time to focus on the value add of nursing, of caring for that patient at the bedside, while we have virtual nurses who can deliver and communicate with patients around the admissions process and the discharge process. And now we utilize it for daily rounding on patients, or excuse me, hourly rounding on patients through those virtual nurses. And so what we've seen is it's added a lot of time back to the bedside for nurses. Patients enjoy it because they feel like they get better communication and better education. So it leads to a better experience for the patients. And from just the throughput times in the hospital, it's improved our admissions time and our discharge times on patients. So that's
Great.
just one example of many where we have redesigned the approach to healthcare.
Are you doing that with iPads or so I'm assuming it's an audio and video interaction with the patient?
It is audio and video. So if you picture a patient room, and so we have, of course, nice TVs in the patient rooms, but we have video and audio equipment attached to those TVs.
I see.
With the video equipment turned backwards away from the patient. And so the patient actually has to invite the virtual nurse into the room. And so that's initiated by the bedside nurse, assuming the patient invites the virtual nurse into the room. They're in, and then the virtual nurse is just like you and I, just interacting virtual between each other, going through that admissions and discharge processes.
Did you see an increase in your patient satisfaction scores once you
We
implemented that?
did. Yeah, we did.
Excellent.
We piloted the approach on a couple of units, and so we tracked those key measures of patient experience, of quality measures, safety measures, and they all improved. And so we've now implemented it hospital wide in Tupelo
That's
with
great.
aspirations to expand it throughout our system.
This episode is sponsored by Audrey Health. Many hospitals rely on their employed primary care network for referrals. However, this comes at a cost as most hospitals operate these same networks on negative margins. Audrey Health is an innovative solution to eliminate these operating losses while maintaining the referrals. Learn more at audreyhealth.com. A link is provided in today's episode notes. So I have another question for you that kind of builds off this technology piece is that there are a lot of so-called experts out there that are convinced that one of the industries that needs to focus on artificial intelligence is healthcare. They're probably right. But what is your view? I know you're a extremely intelligent, thought driven person, and you're very strategic in your thoughts. So, where do you see the role of AI developing out in healthcare? And what time period do you see that occurring?
You know, I guess fundamentally, we recognize that AI can help support us. And going back to that strategy that we have, so two components of that strategy are evolve how we do the work of healthcare. The other is utilize tools in the redesign of that work. So we think AI is an important component or an important tool in the redesign of that work. So we have some experience over the last several years with AI, but fundamentally, I view AI as tools that can supplement the work that we do in healthcare, not replace
Yeah.
healthcare.
Absolutely.
And that's a
Key
very
point.
important concept that we keep in mind with that. And so we look at ways at how the AI tools can supplement our work. And so I'll use a couple of examples. We have several years of experience applying AI related tools. So in the clinical area, for example, designing your electronic health record uh, with AI tools that can help you with the diagnosis and treatment of patients. Sepsis is a key area where we applied some AI tools that help us with the diagnosis, the early diagnosis of septic patients, which will trigger the treatment for that. And so we've seen huge benefits from use of AI in that clinical arena, and looking forward to expanding that into other diagnosis and other treatment areas that tools can help us. But it just helps those practitioners um, aid them in the diagnosis. It doesn't replace them, right? It just aids them, provides the prompts, provides the information that helps them make that diagnosis. We're utilizing ambient technology in our clinics, in our physician clinics today. So that is a tool where um, physicians or providers can have direct communication and focus on the patient and not have to get distracted by inputting information through a computer while going through that patient visit. So the ambient technology picks up on the communication, actually translated into documentation in the report. So it not only gives that provider that focused time and attention with the patient, but it also delivers a great health record after that visit that the provider has to do very little later in time to do it. So it makes them more productive. It gives them a better sense of quality of life in their practice. And so that's just another example. We've also applied artificial intelligence in a number of business operations. So our revenue cycle began utilizing a number of AI tools within management of the revenue cycle process. Just an example, utilize bots that help us verify the eligibility of a patient as a member in an insurance plan. So
Excellent.
historically, that a team member in revenue cycle would have to either call the insurance plan or go online to check the eligibility of that individual patient as a member in that health plan. Whereas now those bots automatically do that when we register a patient. So it saves our revenue cycle team member some 15 to 20 minutes per patient registration on that. We've used it in human resources for recruitment of candidates into our healthcare system as a way to not only help that individual choose job options within our system, but also for us to communicate with those job candidates.
Yeah, those are fantastic applications. Okay, so you're even farther down the road than I thought you were.
Well,
So
I,
that's
I think
excellent.
we're pretty far down the road, but there's a lot of opportunity remaining. In fact, we've established a governance committee of operations and information systems and clinicians together to take a look at the various AI tools that are in development or have been utilized in other healthcare systems to make the decision is should we deploy this within our health system? If not today, is it sometime in the future? All in the spirit of the effort to redesign how we deliver healthcare.
Yeah. Well, your answer is exactly what I expected. It's thoughtful, it's strategic, it's mindful of what's going to be an augmentation of the things that are already going well versus replacement. You don't want to replace, you want to augment. So those are great examples. All right. So question I've got for you is you and I are kind of on the I hate to call us old. We're experienced and we have decades of that experience. Let me say it that way. Still a lot in the tank, but we're maybe in the back third. So, what advice would you have for people that are either early in their career or considering a career in healthcare? What advice would you impart on them?
Yeah, I do have a lot more gray hair today, Tom, than when you and I were last together.
If it turns
But
gray,
I
that's
like to
okay.
chalk
If
it
it
up as
turns loose, that's a problem.
I like to think of it as wisdom, Tom.
Exactly.
We've grown in wisdom over the years, but yeah, there are a few things that resonate with me that I like to share with folks who are interested in healthcare leadership or maybe early careers in healthcare across it. And these are things that I wish I had known when I started out, that I just experienced and learned over the years. I think first and foremost is, you know, choose an organization that aligns with your values. And I see that today, and I see how the values, when they're aligned, is a powerful motivator for folks, and it helps them. And so it's choosing organizations whose values align with yours. Um, Remind yourself why you got into healthcare in the first place. I have the opportunity to talk with our new employees at orientation, and over the years, I've asked the question of them is, why did you get into healthcare? And they would just answer. And the two most common responses to that question were, one, I want to help people, and I want to make a difference in the lives of others. And so I asked them to remind themselves of that, as they go through their job and as they go through their careers. And it goes back to that we as individuals need to stay connected with our purpose and
Yes.
connect your purpose with that job, because that's the real satisfaction in a job, regardless of what that job may be and regardless of what career path you are. So long as you have that your purpose connected with your job, amazing things can happen on that. But don't allow your work to define who you are, and don't let it consume you. I made that mistake early on in my career, still fall into that valley, if you will, from time to time. But don't let it define who you are, and don't let it consume you at all. We in healthcare, a lot of us in healthcare take the job personally, meaning we have a personal connection to it because we affect the lives of others and we have the opportunity to impact it. But don't beat yourself up about it. I think if you're beating yourself up about it, that means you're allowing it to define who you are, and that you're allowing it to consume you as a leader. And then one of our leadership accountabilities at North Mississippi is curiosity. Be curious. Approach every day with curiosity. As we've talked before, there are a lot of changes always going on in healthcare, a lot of uncertain times. But I believe curiosity is a key ingredient for leadership to take on those challenges, to address those uncertain times. And then the last piece of advice I have is, remember, you can control many aspects of your life and career. I realize that there's a lot within healthcare that we cannot control, but there's a lot of aspects within our own lives and with our own careers that we can control. So focus on those aspects that you can control and manage to avoid the distractions that happen around us from those variables that we can't control. Um, we as a leadership team in our healthcare system have to remind ourselves that, you know, we can't dictate or control what happens at Medicare and Medicaid services, right? We can't control decisions made by an insurance company. We can control how we respond to it, how we manage the factors that we can control. And so I think that's really important for us to keep in mind. And it's allowed us to focus on what we think is most important in healthcare and not get distracted by those outside factors that are variables that we have no control over whatsoever.
And that's excellent advice. I wrote a sports psychology book years ago, of all things. I like to read things that are kind of off the beaten path, but they made a great point along those lines. They said that this basically controls an illusion, which Mario Andretti, the great race car driver, he said that they said controls an illusion. You can't control the events that are occurring around you, but you have 100% control over your response. And so that's what drives the outcome. The event doesn't drive the outcome. The event plus the response drives the outcome. So
That's right.
you've provided outstanding advice. Well, Shane, I said at the beginning of this podcast, I thought this was going to be fantastic. It exceeded my expectations. So fantastic job. Thank you so much for investing time to talk with me today. And I wish you and your system nothing but the best.
Appreciate that, Tom, and thank you for the opportunities to join you today. It's great seeing you again, and hopefully we'll see each other again soon.
Thank you for listening to the Healthcare Badlands podcast. As always, please like and subscribe so you don't miss future episodes. If you have suggestions for topics or guests, please email those to podcast@badlands.pro. This podcast is for informational and entertainment purposes only and should not be considered legal advice. Some information shared may include fictitious names. The opinions expressed are solely those of the host and/or guests and are their own and not reflective of the opinions of others or our sponsors. Thanks again for listening, and we hope you'll join us on the next episode of the Healthcare Badlands podcast. Until then,